The majority of toxins that you're going to deal with throughout your life are endogenously produced. Okay, the business of living is a dirty business. Yeah, have you ever thought about why factories were built by rivers? Because they create waste products and they need to dump it somewhere. And our trillions of cells are no different. Each one is a factory which takes in, transforms, does something productive, and then there's a waste product which needs to be released. Life was easy when we were single-celled organisms, because as soon as you're done, you just send it out through that membrane and you're done. Goodbye, Charlie. But as organisms became multicellular and then more complex, we needed to develop a liver, a kidney, a circulatory system, and all these things. So the majority of the toxins you deal with are endogenous, my friends. Okay? I can't tell you how many vegan yoga instructors with totally organic cotton clothes, come to me in stage 4 ovarian cancer. We need to deal with what's inside. It's just like the personal journey through life, okay? Pay attention to what's inside. Most of what's outside you really cannot control. It's what's inside that you can touch. Again, we're going to start with something that I think a lot of you are familiar with, which is the problem of dysbiosis. And the studies definitely associate dysbiosis in the intestinal system with the systemic inflammatory milieu and autoimmune thyroiditis specifically. Inflammation, more generally, there's 2 types. There's the chemokines and leukocyte migration. That's an issue. So these are going to be more of your high cortisol patients. And then you have hyperimmunity, which is like atopy and allergic disease. Patients with allergic conditions, whether it's asthma, eczema, allergies, dermatitis, have a higher chance of developing autoimmune thyroiditis than patients who don't have that. And these are low cortisol patients. So either way, you're going to have inflammation. You're either going to have histamine and mast cell mediated inflammation in a low cortisol patient, or you're going to have cortisol mediating the inflammation and NF-kappa B and other factors. And then you have autoimmunity, which has its own mechanisms. So there's hyperimmunity, and autoimmunity is a special type of hyperimmunity where now you're attacking some part of yourself. So we want to be able to regulate these. So selenium would be very helpful for inflammation because it helps regulate inflammation. And why did I put it in red? Because it also improves T3 production. I like German chamomile. I didn't put it in red because it won't appear a lot in this discussion, but it may be the right one.